are back still here at BJVIM. It's always fun to be here. Pam Toney, it's a treat to see you. And we always talk about what should we share with people? What aren't they familiar with? And I think it's interesting because you do this every day, and I feel like I know enough to be dangerous, right? There's a lot of things I think people don't really realize about what you do, the services you offer, but more importantly, how I go about participating in the services. So I think that would be great. But first, let's say that we are here in the dental clinic, which is amazing.
It is. We're very, very privileged, very pleased, very honored to have this. This started out with a Magro family in the area that wanted to give back to the community, and came and asked us what we needed, and we talked about the need for dental. I think sometimes we don't realize, again, that teeth and hygiene are so very important to mental care. If you can't eat properly, then you can't chew. If you've got problems with your teeth,
that's right. Great source of infection if they're not healthy.
It's a real issue, and also just mental health too. We don't realize that if someone is missing teeth or having bad teeth, they don't want to smile, and then when they get it all taken care of, then they have lovely smiles. That's right. So this was a huge asset to us. We used to refer our patients to Dr. Bostic in Ridgeland. He was so kind to take our patients on, and did that for about 5 years until we were able to do this. And this was a dream of the original people that started Bluffton Jasper Volunteers in Medicine 12 years ago.
How many dentists do you actually have here that serve?
We have 7 now.
Do you really?
Yep.
What are the days of operation?
So, Tuesday mornings, Wednesday afternoon, and then most of all day Thursday. It just depends what the doctor's schedule is, just very similar to what our doctors are on our medical side. Our dentists usually will give us at least 2 clinics a month, and those are all scheduled ahead of time.
One of our new sales reps is here today, Lucas, and he's just joined WHHI. I'm really excited to have him, and we were sharing about about volunteers in medicine, because it's funny, we assume everybody knows.
That's right.
Because it's pretty famous here in the Lowcountry. Can you share with some of the viewers who may not know who comes to Volunteers in Medicine? How do I actually become a patient? I think it's important.
Sure. So we take people that are uninsured, that live in Greater Bluffton or Jasper, live or work in Greater Bluffton or Jasper County, and make up to or no more than 250% of the poverty level. So just to give you a little idea, you could live in Hampton but work in Jasper County and we would see you. Or you could live on Hilton Head and work in Bluffton and we would still see you. Or you can live and work in Bluffton or Jasper County. And making up to 250% of the poverty level would be a starting point at about $34,000
Okay, got
year.
it, got it.
And then another $10,000 for each person that lives in the family. The interesting thing that we have here is you have to be a medical patient. You've got to be a medical patient in order to have the dental.
One of the things that's been interesting is when you fill out an application. Is that how that works?
That's correct.
But that application now is an application that is really universal for other agencies too.
It is. We have just started that. I've been here for 10 years, and this has always been a dream of mine to have a universal application. And so we're looking to other nonprofits to be able to add to this. And so our application would have application for Bluffton Jasper Volunteers in Medicine, Bluffton Self-Help, Lowcountry Legal Aid, a variety of places.
Why is that such a big deal? I mean, it was interesting to me when I learned.
Right.
Yeah.
Well, you know, how many times can you tell somebody that you don't have enough money? You know, that you're struggling. I mean, I think we can just tell that story one time, and then we can just, you know, I think that this population, with all populations, they need to be treated with dignity. And so that's one of the big things that we want to make sure happens.
It's just so interesting. We think of the big picture, but some of these details that are so important to people, it's just they don't get relayed to just all of us viewers. That's really amazing.
Right. And our population is transient, so they may live in one area and then they may think that their paperwork is in one place and then they've misplaced it. I mean, I'm always losing things.
Paperwork too, exactly.
That's right.
Well, it's about time for us to go here on 843 TV, but we're very grateful to have the opportunity to chat with you.
Thank you.
So thank you again for everything.
Thanks. Thanks for coming.
We'll see you all on the next 843 TV.